start with it. So today the session is about NAC OSCE. So NAC OSCE and MCC QE1, both exams are part of Canadian medical licensing exam. So before starting, let's get to know who I am. I am basically a medical graduate, international medical graduate, and I have completed both of my exam. How much score I got? I scored more than 2 standard deviation. That's why I am helping people here that I have already given my exam. So I have better assess and better idea about what you need to know at this particular stage. So what I studied for QE1, I have already made a video on that. And in NAC OSCE, I will let you know what I studied and how I studied. So what sources I used, I will also answer these questions as well. So what is NAC OSCE? So you need to know this is like a verbal exam, just like how we call it Viva exam in our countries. So it is basically a verbal exam. It has multiple stations. It could be 10. If I could remember, it was 10. But sometime I think it was 11 as well. So I'm not pretty much sure if it was 10 or it was 11. So it was like one of each. Maybe it was 10 or maybe it was 11. So they will assess your knowledge and your communication skills. So it is very, very important. And meanwhile, you are studying for it and getting knowledge. So you need to know about your communication skills as well. So some patient can come up with any kind of thought or any kind of idea. So you have to assess what is he asking. And on the basis of that, you have to answer it right away. So it is very important. They will assessing your communication skills along with your knowledge. So your manners, your sitting way, how you are approaching the patient, how you are conducting everything is going to be assessed over there, not just your knowledge. Okay, so each station will be 11 minutes long, and in the each station there will be 2 minutes pause where you will be able to read the question and get to know what you need to say in that particular next 11 minutes. That 11-minute station could be counseling station. That 11-minute could be history and physical examination station. Okay, so in the 11th minute station, if it's a counseling one, then in that particular 11 minutes you are going to just keep on talking. Okay, but if the same time, if that is history and physical examination, then it is going to be 8-minute history and physical examination, which in 4 minutes you have to take the history and build your diagnosis. On the basis of that diagnosis, in the next 4 minutes, you are going to do that focused examination. They say focus examination, it means you need to know what diagnosis is on the basis of your history, and on the basis of that, you are going to do that particular physical examination. Okay, so it is very important that you build up your diagnosis in that particular 4 minutes, and it is good enough for you to do that. Okay, then coming to the physical examination that you have to perform in that particular 4 minutes, and in the last 3 minutes you are going to answer few questions that the examiner is going to ask. Okay, it is not going to be out of your scope. It is going to be regarding the same station, like how you do the long viva in your country regarding that particular patient. You are going to be asked about those questions. Okay, then moving on to the next one, what topics they will assess. So they are going to ask about medicine, surgery, pediatrics, obstetrics and gynae, psychiatry, preventive medicine, and public health. So they are going to ask one of the question of ethics, basically, where you are going to talk about counseling, you are going to assess the patient, how you are going to communicate an angry patient. So those kind of questions can come along with it. And it's very easy that you need to know because in that particular station, they are just assessing your ethics and your way of communication skills. Okay, so it is very, very important. Then let's move on to the next one. What book do you need to study? So this is basically what book you need to study. So it was when to book the exam. It was when to book. Okay, so it was when to book the exam. It was basically like it's up to you, like how much time you are giving it. For me, I took like 3 months. For you, you can take 6 months, 3 months, 9 months, whatever you feel comfortable in. Because this is kind of expensive exam, so don't rush it. Try to pass it in one go. So that's why try to take as much time as you can. And when you feel like you are comfortable enough, then go and attempt the exam. Because it's kind of like expensive. So that's what I'm saying. And failing this exam is quite possible. So that's why try to have a comfortable, when you feel like, yes, now I feel like I can do it, then go for this exam. But that particular thing, you need to book this exam 3 months before that particular time. Let's suppose if I have to take the September, October one, then my last date would be on June Hardly on June. Yes, I think it was June or May. They will tell you that after that you cannot book the exam. So it is going to be like 3 months before that exam is going to happen. Not like QE1. QE1 you can book at any time, but this one they will give you a certain time period and you have to book the exam in that particular time period. Like certain amount they will put you, and about that we will keep on updating each other in the group, and you will get to know when is the time or good time to book it. Okay, so meanwhile you can start preparing for it right now. Then moving on to the next one. What is the next one? How much do I need to prepare? As I told you, I took 3 to 4 months approximately. Need 6 months too. Like it depends on your time availability, how much time you are giving this exam. It is not something that you can just wake up in the morning and go for this exam. No, it is just like the same QE1 exam. It needs more preparation than QE1. That's what I feel, because you need to develop your communication skills. If let's suppose you're not good in speaking English, because we can understand English, but sometimes it's hard for us to speak English in a very fluent way. They are not assessing your grammar or they are not assessing your English, but then you need to know particular amount of or particular words that you are going to say. Just like in CDM question, when you are writing something, you need to know the words what you are going to write in that particular CDM. Just same here. If you don't know how you are going to counsel that angry patient, how you are going to say if somebody says I have pain, right? So if you don't know how to answer those questions, it is not in your history. It is basically how you are going to communicate. This is how they are going to assess your communication skills. So it is very important that you build this kind of ongoing and off and on conversation. Somebody saying something and I have this like response developed in me, and I replied it at once. I don't have to think about it. If I am going to say I'm sorry, can you say it again? Like when you don't get something, you say I'm sorry, can you say it again? That's what it's something, your response is coming. So it is something that comes in you without even checking you. So that's those responses that you have to develop in yourself. That's why you need 3 or 4 months to develop those rapid responses. So what resources you need? I use Dr. Basil notes. You can use Edmonton manual, clinical bedside, NAC OSCE orientation. There is so many PDFs. You can use all of them if you want. But I think Dr. Basil notes is more than enough. But I use Edmonton manual for ethics question because Dr. Basil notes is not covering those particular ethic questions. So I used Edmonton manual along with it. So you can use 2 books, 3 books, whatever you need. These are the basic resources. There are other as well, like, but this one is like considerably a lot of people are using it. Okay, then how to start? So when you are going to start, take a course, because we don't know how the NAC OSCE work. So you need to know an orientation where they tell you how you are going to start the history or what particular question you need to ask in that particular 8 minutes, right? In that particular 4 minutes, because when you are dividing that history in 8 minutes, you can ask anything, whatever you want. But if you are going to cut it down from 8 to 4 minutes for the rest of the 4 minutes for physical examination, now your question should be so precise that you have to build your diagnosis. Then in the next 4 minutes, you will be able to do physical examination. That's why an orientation is very, very, very important for NAC OSCE. Like getting orientation. If you can get paid courses, if you can get free courses, whatever you feel like, just take it and practice a lot. Get a study partner, do practice a lot. I took that particularly course because there was only 10 students and I was the one who can keep on presenting again and again in each class. So I have the chance to present in each class. That's why take the course where there is less students and you have the chance to present in every class. So it will build up your confidence. It will help you to understand it. So it is very important that which course you are taking. Believe me, if you chose the wrong course, you will be in trouble. So you need to find out a good source and good like course. Because if you are going to start from somewhere which is wrong, or you are taking something which is not helping you, then you are just wasting your money. So you can take the course which is basically helpful and practice a lot. Because if you know what orientation is, after taking a good one big course, you don't need to take crash course. But if you didn't take a full course, you can take the crash course. Okay, both you can take together. If you want to take a full course and if you have enough finances, you can take crash course as well. And along with it, if you want to take a mock, I would highly suggest to take a mock. Mock is basically when you are going to assess the same situation and somebody is assessing you. So you can take mock as well. This is basically one-to-one session. So take it. Right now, the physical examination is in person. That's why I would highly recommend to take something which is in person. But if you cannot take something which is in person, because in person is kind of more expensive. Taking online on Zoom mock is totally okay. It's totally fine. That there's going to be totally same. But for the physical examination, I would highly recommend to practice it on somebody who is in with you, like, you know, practicing on your child, practicing on your husband, practicing on some friend. You can do it any person, like, so your availability to that particular person, you are not hesitating or not trembling when you are doing the physical examination on actual SP. Okay, so it's very important that your reflexes are strong, your way of doing is strong. You are not just trembling in front of the like doing it, because this is going to be like how you go to a clinic and start practicing the or checking the patient, right? So it is very important how your confidence is. So it is, that's why I'm saying keep on practicing, so your confidence is so good. Even if you're doing something wrong, your confidence is like, confidence will give you enough like support. But you should be like in correct way too. It's not like if you do something wrong, the examiner is going to be like, you know, giving you marks for confidence. No, it is not going to work like that. He will give you mark if you do the right steps, but your confidence is important as well as your other thing is. Okay, so getting one-to-one course is very, very, very important. Even if you are starting, there is, what you need to know is how to answer made up of question. Made up question, like something, you are taking a history and suddenly a question pop up in the patient's head, and he suddenly asks you like a random question. So how you are going to answer that random question? It is very important, right? So that's what I'm saying. Your reflexes are important as much as your confidence is. So if somebody asks you something randomly, if you don't know what you are going to say, just like if you don't understand somebody what is saying, so you are going to say, I'm sorry, can you repeat it? Pardon, can you reply, say it again? Something like this, right? This is called high reflexes, that you are going to ask that particular patient politely, can you repeat it? It's totally okay. And one more thing I didn't mention here, you cannot repeat your question. Never ever repeat your question. Like, this is something which is a no for NAC OSCE. Let's suppose if I already asked somebody that, like, have you ever been to doctor? And he said, he told you that I have never been to the doctor and I have never taken any medication. You repeat that, have you taken any medication? It means you were not listening to the patient. It will give a very bad impact on your history, on your physical examination. You might get negative marks on that. So you cannot repeat your question. It is very, very, very important that you know which things are going to give you plus marks and which things are going to give you negative marks. Plus marks when you are going to ask the patient politely, or something like, you know, if he make up a question, you are able to answer it, right? And if you are going to repeat your question, you will be in trouble. When I started it, I was keeping on repeating a lot of questions. So I have to work on that one. So you need to work on that as well, because you, if you repeat the questions, it's not a good thing, because it feels like you are just in your history, you want to just complete it and you don't want to, like, you know, communicate with the next person. So communication, that's what it is. Your conversation of the history should be back and forth, back and forth. Whatever you are saying, there's going to be saying that again. If you ask something out of context which was not in that needed history, right? Let's suppose I'm going to ask about heart condition, and I started talking about what is your urine, how was your urine. I mean, in it, that is not even important in that, like other conditions, right? In MI, why I'm asking about urine? So that particular like SP is going to keep on looking at me, is not going to give you answer, and that will also put you in trouble, because now you don't need to you don't know where you need to go. Should I repeat this question, or should I just like move forward? Now you are stuck at one point and you will be confusing, SP will be confused, your time running out, everything is like messed up. So your questions should be very oriented, your physical examination should be very oriented. Let's suppose if you do something which was not necessary for particular NAC OSCE thing, right? And you did something which was not important, and you wasted time on that, and you didn't do important things. Let's suppose I was going to do carpal tunnel syndrome and I didn't do Fennel test or Tinel test. Those two tests were so important. I was keep on doing other stuff and I missed those ones. I'm not going to get any mark for that. Okay, I mean, I'm not saying not any mark, but you will not get marks for that particular test that was written in that script that he should do it. Okay, so your physical examination should be very oriented. Then coming to the nice words for communication. As I said, your words are very, very important when you are communicating. Like if you cannot say, can you repeat it? You should say, I'm so sorry. Can you kindly repeat it? I couldn't hear it. This is such a nice way. That's what I'm saying. Manners are so important in NAC OSCE that if you replied in a blunt way, uh, you will be in trouble. Then coming to the time orientation, as I said, you have to know in 10 minutes what are you going to ask, like particularly in 11 minutes, what are you going to know in 8 minutes, what are you going to say in 4 minutes. So this is very important, your time limit. Okay. Then moving on to the next one, what is physical examination? So you have to perform on SP, because before we were just verbalizing it. Now you have to perform on SP. So practice on the people who are around you, your child, your husband, your friend, or anything that is like any person who's available to you. You need to know how you cover it in 4 minutes. So physical examination will be highly done in 4 minutes. So you need to know in that 4 minutes what you need to do, because you cannot cover every single thing in 4 minutes. Okay, so at least you know that what should I do. Make your notes. I mean, you cannot keep on repeating Dr. Basil notes. I made my own notes. I made my own differential diagnosis. I made my own, like, what I'm going to do next, what I'm going to do next. So use your own notes. Or if you somebody or some he's senior who has used some notes, you can use that one. It is important your speed, but same time you cannot make SP uncomfortable. Let's suppose you are doing rushing it so much and you are just pulling his shirt and putting it here and there and like making it super uncomfortable. It is not going to give you any mark that you were rushing it and making that person uncomfortable. Okay, so I think that's it. I have already given a bit of orientation. If you guys have any question, you can ask me. So some said, which score is good? So it says if you scored more than 1400, it comes in one standard deviation. If you scored more than after 1400 score more than 25, it comes in like mean or something. Then comes more than 30, it's like two standard deviation. You can see it from there. Okay, which one are high yield? I may what's it? Can you please name that courses are they used? Okay, which one are high yield? I mean, they are, everyone is giving their best in their courses, so any course is good. So if you feel like, because it's up to you how much you catch from that particular course. Okay, you can take any course. Just there, academies, there are so many academies who are charging so much. If you feel like, you can take those ones. But I personally don't comfortable when so many people are there because I couldn't get the chance to do it. And I want something where I have to perform in every class. That's why I took the precise one where there was less students. You can do it more than that. You could verbalize our finding during examination, or we should wait and conclude finding at end of the 4 minutes. After 4 minutes, they will ask you what was your finding. If, because in that 4 minutes you will not be able to cover everything. Believe me, how much speed you have, in 4 minutes you will take 4 minutes to complete it. When I was verbalizing, I couldn't complete in 4 minutes. Do you think you will be able to perform in 4 minutes? Like, it's kind of like not going to work like that. So after 4 minutes they will ask you what was the finding on physical examination, what was the finding on auscultation, what was the finding on that, and they will tell you on that. Okay, any other question you guys have? It is very important that you keep on practicing. Take one-on-one course, whichever is possible. Why I'm saying course, because there's so many. If I say one and didn't take another name, they will be like, why didn't you take my name? So you can take one in-person mock, because I could afford it. So I took one in-person mock, and that in-person mock give me a little bit of idea how exam is going to be coming. So in-person mock is really good. If you cannot take in-person mock, at least make an environment at a home, like put a one room, put one person to assess you how you behave, and one person like a patient or like SP, and you go inside, you will be able to see how you are behaving. Okay, it's totally okay. Just see how you are working or performing at that particular environment. So you have to get used to with that environment. And believe me, when you are entering that room to perform that test or history and physical examination, don't feel like you are giving exam. Feel like you are going to go inside and do check a regular patient, like how you do in clinic. That's what I believe, because when I entered the first room, I was so panicking and my hands were trembling. So luckily we were not able to perform it. But in the second one, when I was about to enter, I'm like, I am a doctor and I need to get it done. The patient inside sitting down, if I start showing up that I am like trembling, then he will become uncomfortable as well. So making person uncomfortable is when you are trembling, pulling the patient. And at the same time, one more thing that I want to mention, when you are asking about clinical things, always ask about psychiatry things as well. This is one of the very good point that I want to highlight here. When you are doing something clinically, like asking about chest pain, make sure you rule out anxiety as well. Okay. If you are asking about weight loss or diet, ask about depression as well, because might be depression is happening, might be some psychiatry issue is happening. So that is also important. Okay. So there are red flags questions that you cannot miss in the history that you need to ask, and that will particularly have a lot of marks. Okay. So that's it for the NAC OSCE. If you guys have any question, you can ask me. Otherwise, we'll stop it here. No question? So try to get a NAC OSCE, try to start practicing with the study partner. Do practice it for like good 3 to 6 months, and get used to it. Try to ask somebody to assess you. Get one-on-one courses. It's totally okay. Like, one-on-one courses is not going to cost you a lot. It's going to be like $50-$60, and I feel like that is much more okay than taking it like those ones. So take the NAC OSCE one-on-one courses. I would highly recommend take one-on-one courses, because there is only one person who's looking at you and you are performing in one person. So they'll be able to see how you are communicating, how you are behaving, how you are sitting down. I would highly recommend that somebody who can also see how you are sitting down, how you are behaving, how you are starting, because these things also work, believe me. Okay. If somebody has any question, please ask me. Then otherwise, we will stop it here. During QE1 preparation, how can we prepare for NAC simultaneously? So what you can do is you can QE1 in the morning time, but the NAC you can do in the evening time. So try to set up the time in the way, or whoever is studying with you, try to ask him in the end of the session. Like, let's suppose you find a study partner. There is a lot of sessions in person that is in Toronto, I think some in Alberta. It's totally okay if you cannot take the in-person mock, and if you couldn't find it, I mean, you can use the one-on-one mock too. During QE1 preparation, how can we submit it? So you can adjust your time, morning, evening, morning, evening. Okay, I want to know which things I need to focus on during QE1, which will help in NAC. Those when you are preparing for the QE1, don't forget the red flags, don't forget the history question, don't forget the physical examination, don't forget the treatment, because this is going to be eventually tested in your NAC. And there are particular topics that is going to be assessed in NAC. When you take the courses, they will let you know. And at the same time, there are also some given on the MCC website. You can see it from there. So you don't have to do every single thing. There are particular things that should be assessed. As they said here, what are they going to assess? Medicine, surgery, pediatrics. So if you go to Dr. Basil notes, they have already given what could be like those courses would be. So if you go and see which topics, so do those topics when you are doing QE1 more precisely or more efficiently. So when you are doing NAC, it would be easy for you. You don't have to go out of your way and study again. Which exam you felt harder? I feel like more than QE1, NAC was harder, because I was keep on panicking in NAC and somebody was looking at me. When you are saying something and somebody is there to look at you, how like that frustrating environment is. I mean, QE1, you just write it down, you give it, and you came back. Whatever happened is going to be happen anyway. But in NAC, whatever you're doing, you are like somebody's looking at you, shaking his head, you are, and their eyes and everything is making you feel like, something like that. Total duration of NAC, it started, mine started at like in the morning, 8 to 11:30. So I'm not sure how much it takes. Oh no, actually it started at night, not 8. 9 to 12. It was 9 to 12 something. So yeah, it was like NAC one. Because in QE1, you're just going to write it down and come outside. What is going to happen is going to happen. But in NAC, whatever you're doing, you know what you are doing. And even somebody else is looking at it and knowing what you are doing. Okay. So that's it. And if you guys still have any question, I'll happy to, answer it. So you can just say it.